All right, it looks like we are good to go like always. Guess what, y'all? Another week has gone by, and you know what? It's a little bit of an overcast day, but I'm happy that I'm here. Guess what? You guys, you are officially rolling with Ramsey. Hey, gotta love it. I'm glad to know and hear that we are out here and we are making it do what it do, and it is another beautiful day on this earth. Like I said, another week has gone by, and it is just, I'm thankful just to be here. Thankful to be here. Awesome show that we're gonna have today. Phenomenal dentist that we're gonna have on today, Dr. Keith Macdonald. He's just too cool for school. I know that some people might be afraid and say, man, I love my dentist. I really do. I thoroughly enjoy going to the dentist. I know y'all might think I'm just a little quirky with that, but it's the truth. I really do enjoy going to the dentist. Why? Because oral hygiene is important, and I believe that I got $1 million smile, and I got to keep it right. Come on now. I got to make sure that I'm straight. But we're going to have an awesome show today. But I just want to make sure that I'm paying attention to what's happening today, because it seems like I'm always coming on, and my show always is hitting some significant events that are going on and taking place. And I'm just going to say this. So the grand jury announcement came out for the Breonna Taylor case. If you're not familiar with that, that is the young lady who is an EMT in Louisville, Kentucky, where the police went up in her house with a no-knock warrant. And unfortunately, during the incidents that took place shortly after that, she was killed. Everyone, it's been polarizing the nation with everything that's taken place, and everyone has been patiently waiting to see what was going to transpire if the officers who were involved in that situation were going to be held accountable. I will quote Dr. Martin Luther King Jr., "An injustice anywhere is a threat to justice everywhere." He says later in the quote that whatever affects one directly affects all indirectly. That's what I'm going to say about that. I think that there are a lot of things that we need to change in our justice system, a lot of things that we should review to see if they're fair and equitable on both sides, on all sides, actually. And justice for Breonna Taylor, my heart goes out to her family still, because regardless of the outcome of anything else, nothing that can be done or said is going to bring her back. May she rest in peace. That being said, we're going to be talking about these pearly whites today. And my guest is already available. He's in the waiting room, guys, and I'm excited to have him on board. Make sure that you have your questions ready to be able to come on, talk with him. We're going to be talking about oral hygiene, things like that, the effects on the body that you may not be aware of, and things that are happening and checking and places within your body that are directly related to your teeth, and the nervous system, and things that run up in your jaws, and stuff that I wasn't even aware of until I was having a conversation with Dr. Mac about everything that we're going to be talking about today. And so I definitely am excited to have him come on today. So it's going to be a great show. And that being said, what am I doing? Let me make sure that I go and get Doc out the waiting room. You guys bear with me as I bring him in. 1 second. Not going to take too long. Where's Doc? He's missing. He's missing in action. He's not looking at his clock. He's got me looking at a chair. There he is. Look at it. He came and made a grand entrance. I
How's it
love
going?
it.
What's up?
I love it.
How you doing, man?
How you doing? So,
Pretty
everybody,
good.
everybody, check
Yeah.
this out. Listen, this is my good friend, my dentist, over 30 years in dentistry, graduate from one of my favorite basketball teams, the University of North Carolina, the Tar Heels, BS in chemistry, and he went on to graduate from dental school right there at UNC. Dr. Keith Macdonald of Triad Cosmetic Dentistry, you are officially doing what?
We're gonna roll with Ramsey today.
Hey, that's what I'm talking about. Hey, so Doc, how was your day today?
It was good. Busy as usual. We have four dentists, and we're working hard. We're trying to do a good job.
Oh, that's awesome. So one of the things, Doc, I asked you to come on board because you are the first, you are the start of what I'm going to be calling my healthcare series. So you're the first doctor, my dentist that I'm bringing on first, and for the next 4 weeks, it's going to be all about our health. So we're going to go from my dentist to a physician, then from a physician to a chiropractor, then from a chiropractor, we're going to bring somebody on as an advocate for mental health. So we're going to this healthcare series is going to try to cover the whole gamut per se. Total wellness care is what I'm going to call it, but this is what you're the first. And so, Doc, one of the things that I've been telling everybody is we're going to be talking about oral hygiene and the effects on the body. And a lot of people are not aware of how them failing to make sure that they're taking just the basic care of their teeth can affect other areas in the body. Talk to me a little bit about that and some of the things that can happen.
Well, bacteria in the mouth is really crazy, and everyone has the same bacteria, but some people have the ability to fight it off, and some people don't. So if you have periodontal disease or the gums bleed and you have infection, the infection that you have in your teeth can affect the heart, diabetes, the ability to fight off infections in your body, because the oral cavity is the first pathway to the body. So if you have an infection in your mouth, you're swallowing bacteria, you're swallowing it into your stomach, it gets into your system, gets into the walls of the heart. So it's very important to keep a very healthy, mouth and gingiva, and make sure that everything is good.
Wow, that is crazy. Like just knowing that, first of all, that like that oral cavity you're talking about is like one of the first major opening ways like to get inside the body. I would never think about it like that. And I know that when we were talking about yesterday, if you're failing to just do basic brushing, which leads to other things, gingivitis, gum disease, and you were telling me yesterday something about how that can like directly affect your heart as well, right?
Yes, it's amazing how the same bacteria that you have in the periodontal areas of the mouth where the gums and the bone is. If you have infection there, the same bacteria is the same kind of bacteria that affects your heart in things like rheumatic fever, strep bacteria, building up of plaque bacteria for atherosclerosis, diabetes, and things like that. So people think that there's a direct correlation. What's really important is there's a direct correlation between heart disease and the percent of people that have periodontal problems and heart disease is directly correlated. And there's a lot of articles about that in medical journals, dental journals, and stuff like that. So it's very important for people to really do a good job and go to the dentist to make sure that they take care of their gums and their teeth.
Wow, that is phenomenal to even hear that because, coming from a person like me, and I know that you mentioned it yesterday, and we were um, talking just about things like what I want to share is just about sleep. And you were talking about sleep apnea, not being able to get enough sleep, and how then that leads to other things which causes other problems. I know for a fact that serving 23 years in the military, being a disabled veteran, having PTSD, I will tell you that one of the things for me at one point in time was chronic insomnia. Like I could not sleep. It was like my body did not know what time zone that I was in. And
Yes.
I personally, I know for a fact that I've been prescribed mouthpieces over the years. I just didn't understand the ramifications of why they were giving them to me and why I was grinding my teeth until I talked to you yesterday.
Yeah, I mean, you're talking about airway. It's all about airway. So if people have loose teeth, their teeth, they extract teeth, they have missing teeth, your bite changes. So what happens is when your bite changes, you develop collapsation of the arch, your airway closes down, your tongue goes back into your throat, and you snore. If you snore, you're not getting oxygen. Oxygen is very important for your heart enlargement, diabetes, high blood pressure. It's all related to the effects of sleep apnea on your heart. So dentistry is directly correlated to those kind of things. If you go and you're grinding your teeth at night, you're sleeping, and you're not basically breathing while you're grinding, your airway's closed, you develop heart problems, diabetes. It's directly correlated to that.
Wow, that is that is something that one would never, you would never think about it like that. And you definitely wouldn't be looking at it from an oral hygiene perspective to know that your teeth are even involved in that at all. And I know that we were talking yesterday, and we were talking about how you've had people that come in and they've had headaches or they've had eye problems or other problems, and you make an adjustment to the alignment of their teeth and things like that. And before you know it, they're like, oh my God, I don't get these headaches anymore, or I'm feeling better, and things like that.
Yes, it is amazing. We have lots of patients that go to medical doctors for years, neurologists and headache doctors and MDs for migraines, and all it is their bite. Basically, the way that they clench and grind at night develops pain in their joints, gives back pain, neck pain. They go to the neurologist, they go to the chiropractor. Chiropractors actually, as you do your healthcare thing, the chiropractors are really good at recognizing the muscles of the face and head and neck, and also mastication, which is the muscles of the mastication. They're very good at helping people with, and they're the best at understanding the correlation between bruxism or clenching of your teeth and sleep apnea, muscle problems, headaches, migraines. A lot of the physicians, on the other hand, they treat most of migraines and neuro problems and headaches and migraines and stuff like that with drugs. A lot of times, all it takes is, like you said, is the mouthpiece or an occlusal adjustment. We'll adjust the bite and then we make them feel better. We've had several cases where we actually just do orthodontics. We don't do anything else. We just put braces on. My wife is an example. She had problems snoring deep bite, and we basically reconstructed her whole entire case through a neuromuscular type lower jaw advancement. And right away, immediately, the snoring went away, her headaches went away. Lots of people that we treat like that. So I mean, dentistry is not just about doing a filling. It's not just doing a root canal or a crown. In our practice at Triad Cosmetic Dentistry, we really pride ourselves in understanding the whole picture of your health, why you whether you're clenching, your occlusion, do you have wear all over your teeth, and we ask questions like that of our patients, like are you sleeping well? Do you have a problem snoring? And we are able to actually sometimes fix their snoring just by adjusting their occlusion or their bite, which is the same thing, or giving them a mouthpiece, or actually do some orthodontics, which is braces. And it's really fun. It's really fun to help people like that. And a lot of dental practices they're tooth doctors. Basically they just fix teeth that are broken. We don't think like that. Like when we build your case that we're doing right now, it's going to be nails. It's going to be perfect, and we're going to make sure that you don't hit something wrong. Because believe it or not, if you do dentistry, just a little bit of dentistry, the wrong way, you could affect somebody's occlusion and bite to the point where they don't sleep the rest of their life.
Wow.
And that's a true statement. So
Wow.
it's really cool stuff.
Wow. Hey, Aleda Austin, I see you. You're rolling with Ramsey. Hey, Aleda has a question. Aleda said, is it possible to have a form of dementia from having multiple tooth extractions or hallucinations? I think I got it right. Yeah.
I'm not like an expert on dementia, although I'll probably get it.
I hope not.
You're talking about.
I wish that on anybody.
Dementia, in my opinion, and this is true, the dementia is directly associated with lack of oxygen during your whole life. So if you're a sleep apnea person, you're occluding blood flow to your brain and oxygenation of the brainstem. So of course, in the brainstem is where dementia happens, of course. And then if you basically don't breathe while you're sleeping, you're killing cells in your brain. So if you extract teeth and then you collapse, okay, the vertical collapsation of your vertical teeth because you've extracted your posterior teeth or whatever. I only want the front ones. Basically, I hear that a lot. I only want my front teeth. Okay, good. You only want your front teeth, but the problem is then you're going to collapse. You're going to close your airway, and then association with dementia. Dementia is a lack of oxygen to the brainstem. And it's also hereditarily, people have the gene for that. So that's also double trouble.
Wow. Wow. All right. So we're going to back up a little bit. I know that we talked about you, and when I brought you on, you've been in dentistry for over 30 years, but you're in a very unique situation because you're there in your practice and you have 2 of your 3 sons there in your practice as well. And I think that's pretty cool because, anybody can walk around there and say Dr. Mack and you're like, okay, which one? So having your 2 sons there is pretty cool. My question to you is, did they always want to go kind of into the family business?
Say that one more time.
I said, did they always want to go into the family business?
Well, it's sort of funny. I have a picture of Daniel, the middle one that's there first, on the front of my dental practice on Baker Road in Archdale when he was 3, and with the sign, and the whole thing. And they used to live upstairs and play upstairs while my wife cleaned teeth. And so, it's sort of like they were just there playing in the dental practice while I was doing dentistry because my wife worked for me for like 15 years, and she was a hygienist for my dental practice. In fact, patients of mine still ask me, where's Terry, how's Terry, blah, 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 and it's really fun. There's lots of patients that still come to me after 40 years, and Terry cleaned their teeth, and the kids played upstairs. So, I mean, yes, I think that it's just was bound to happen.
Wow.
It was fun. It's fun.
That's awesome. I will tell you my experience there, being able to come, like I was saying earlier before I brought you on, I thoroughly enjoy coming to the dentist. It especially, I will tell people, when you have a dentist that you are comfortable with, you can build a relationship with, and you trust them. You trust what they're recommending that you have done, and you feel good about it because once they do one thing, another thing, you're like, okay, this is good. Let's keep this going. Let's keep it rolling. And I was joking earlier, and I said, hey, I like Dr. Mack because he's going to make my $1 million smile like a $10 million smile. So I'm a definitely stay on board and make sure that we get everything done. But we're in the middle of this. We're in the middle of this pandemic. How has that affected your practice and people coming? Have some been afraid? Have you had patients who said, hey, I'm not coming back? Or have you experienced any lag per se?
Well, that we were very worried, of course. We closed from March 15th. It was very sad. We had a lot of staff members crying. We never have laid off anybody ever. I work 6 days a week since I've been 26 years old, so I'm a workaholic. And wow, what is it like not to work? So what we did, we have 4 dentists, and we worked from March 15th 1 day a week for emergencies only. So therefore, we had 6 days off, which is very weird for me that used to work 6 days a week. 6 days a week, meaning I work all the time on the yard and the mail and whatever. Yeah. So when we went back, we had to buy N95 masks, shields, gowns, extra special, super duper stuff, and we were worried about whether someone would get it, or we would have to close, or we would have to do something. But interestingly enough, it becomes where the dental practice is the one with the shields and the gloves and the masks, and the patients come in and we test their temperature and we make sure that, and if they have a fever or they're sick, we don't let them come in. And in the entire United States of America, this is a true statement, because it would be on the news. It would be on. There hasn't been, knock on wood, there hasn't been one dental practice since the opening of May 15th by all the states. It's all the way till September, one dental practice in the United States that's been on the news. So that means that dental practices are safe. We do a very good job on making sure that we take the temperatures, and we only treat people that are not either are not sick or coughing, of course. And we also wipe down the rooms. We wear masks. All patients are required to wear masks, and it's been better than we thought. So we feel very comfortable coming back and doing dentistry in the world of COVID. Although it's unfortunate, things are good all over the nation for dentists.
Oh, that's awesome. That's good to hear. And I mean, I want all my listeners to hear that, and everybody watching to understand that, because just like we were talking a few minutes ago, your oral hygiene is very important. It is very important. So that being said, for those who still might be afraid, we still have to make sure those that are afraid are coming in. Let's get back to the basics very quickly. Basic oral hygiene. Elementary. What do we need to be doing?
Well, I think the key is the stimulation of the tissues of the gums. Okay. In the sense of people brush their teeth, but they need to make sure that they stimulate. Let's say you brush your teeth and you bleed. Some people go, "Oh my God, I bleed when I brush my teeth." What you should do if you bleed when you brush your teeth is brush your teeth and make them bleed, which is the opposite of what they think, because stimulating the endotoxins to be released from your periodontal gums or the gums to make sure that then the saliva and things can get around the teeth. The most important thing is saliva. Saliva actually has a salivary amylase that actually is something that actually kills bad pathogens, like we're trying to kill the COVID virus. We already have that. So if you bleed, then the salivary amylase gets around the gums and it kills the bad pathogens. What people do is they go, "Oh, I bleed. I'm afraid. I shouldn't brush so hard." Well, actually, it's the opposite. You should basically make sure that your gums don't bleed. And the best way to do that, of course, is to floss. But as we know, people don't pick up the floss and they don't go crazy with it. So as you and I were talking yesterday,
I'm guilty.
yeah,
I'm guilty. I'm not a flosser. I'm guilty.
You're guilty. You're guilty. All men. Hey, by the way, all men are guilty. Ha ha. It's like whatever. Women do better, of course, 4-1. But it's a written article about this. I mean, basically, women for sure do better at flossing than men. But in the sense of the best stimulation for your gum on the market, is probably as we were talking yesterday, is the Waterpik Sonic Fusion. What that is, and it's fantastic. It's $151 at Walmart, and it's a water pick and a brush. So as you're doing the brush, it's an electric toothbrush with a water pick. It's blasting water flosser into your gums while you're massaging your gums. Another one is an Air Floss Ultra by Philips.
Okay.
So there's really some good things out there now that are way better than the pick up the floss, go through. It's better to floss, okay? But if you're not going to, gum stimulation is more important than anything. People also don't realize that fluoride toothpaste is it doesn't. The teeth have already developed their enamel. So basically, fluoride toothpaste is more important when you're growing up and stuff. So we recommend, of course, I recommend even organic coconut toothpaste or Tom's organic toothpaste. So there's a lot of different things out there.
So
rinsing with coconut.
That's a good question because now
rinsing with coconut oil.
Wow, I would tell you that's a good question because I know when I got my first implant or whatever, Crest has since come out with this Crest Gum Detoxify toothpaste, which I use. Because it's supposed to help you keep healthy gums, as well as be good for your teeth as well. So
it's good for the implant. Yeah.
Right, and so just making sure that your gums are healthy, and that's one of the things that I use. But that's really cool to hear about organic toothpaste because you're right. We're an adult. It's not like we're lacking. If we're lacking fluoride at this point, we got a lot more problems probably to worry about.
Yeah, the herbal stuff is not that bad. I mean, I'm an advocate for the coconut, the tonic tooth. We have a range called a tooth tonic that has really good herbs, all organic, no poisons, no preservatives, no fake stuff, and it really does help the tissues. They're anti-inflammatories. If you think about it, it's like turmeric. It's the same thing. Rinse with coconut oil and turmeric. Peroxide in water is excellent for gum health.
Okay.
Excellent. So you brush your teeth with Crest toothpaste. I'm not saying don't use that, but there's other things that are really good for your gums, like peroxide in water. We actually have something called Perio Restore in our office that is a peroxide toothpaste. That's excellent for gum health. So there's things to know about that whole thing. It's really cool stuff. Yeah.
Oh man, that's really cool. So you go to UNC, become a Tar Heel, go to dentistry school, go to dental school, come out, boom, 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 and you're doing it. You're doing it. Got your wife working for you. Things are going great. You're having kids. Then when did you make the transition to say, you know what? I really want to make people's smiles to be great. So when did you make the transition over to being a cosmetic dentist as well?
Well, like everybody, in 1982, 1981 when I started, it's pretty much you're pretty much fixing teeth. Pretty much fixing teeth. From 1982 to about 1998, which is about 16 years, we pretty much had a great dental practice. We cleaned teeth, we did dentistry, stuff like that. And then I said, I just felt like I needed more education. Like you go to dental school, and then you go to these seminars that are like a little boring and stuff like that. And so I went into implant training in probably 2004 or 3. And I decided to do full mouth rehab in implant dentistry and get into advanced cosmetic dentistry. But the way I did that is I actually went back to school. So I went to Miami, I went to Seattle, I went to Scottsdale, I went to Chapel Hill. I went to a 200-hour continuum in Chapel Hill or Cary with the Triangle Implant Institute in 2009. In 1 year, 200 hours of education. And before that, of course, veneers and cosmetic dentistry was big, but the difference is that now we can replace missing teeth And then as we got into 2014 and 15, we got into laser dentistry, fixing gums with laser, killing pathogens with lasers, which is really cool. And I am an advanced laser dentist. I'm a fellow in the Advanced Laser Academy of treating periodontal disease with laser dentistry, which is really good. It's way better than getting your gums split open. And then the airway thing in 2015-16 with regard to sleep apnea and occlusion and muscles in the face. So literally, it's education. It's all about not stopping. And I definitely try to transfer that information to my kids. You got to go to see it. You can't. To be the best, you have to go to the finest institutes in the United States and learn from the best dentists in the world. And they're in these centers that we have to travel to. But with COVID, we can't travel there. But it's been great. The education's been great.
Wow, that is phenomenal. Because I will tell you, I know that, like you're saying, you see all these commercials on TV now. Hey, come in today and leave the same day with a whole set of teeth. And I'm like, okay, if they're saying it's possible, it's possible. I said, but that has got to be, at some point in time, that has got to be like an experience. I cannot imagine, because I remember my mother. Now I'm gonna tell you, I remember my mother. My mother was very big. May she rest in peace. She was not getting dentures. My mom was like, I'm not getting dentures. And I remember my mom, I don't think she had a full mouth of implants, but she had, in key places, she did have some implants. And I remember at one point in time, and this was early on, so this is my mom I'm talking about, she had to go back a couple of times because they were giving her some problems. And she didn't get them done here locally. I remember she flew somewhere. I can't remember where, but she had to fly somewhere. So it wasn't like it was the big thing back then. In the beginning, it was, okay, you're going to get dentures. It is what it is. This is the best route. And then implants finally came on the scene, and there wasn't a lot of dentists that were actually doing it. So I remember my mom actually having to go somewhere to have it done.
Yeah. I mean, basically, the technology now with digital dentistry, you could actually place implants and give people teeth in the same day. For sure, years ago, you could not do that.
Yeah, I mean,
it is amazing the changes.
And I mean, and I'm pretty sure there's a lot of people who have watched a lot of the, I guess, transformation shows, so to speak, like The Biggest Loser and things like that. And when they do their final transformation, I know that a part of the end process they do is the dental part, and so they not only come back with all this weight loss, but they always have like this they have like this $1 million smile too, which they never really talk about. But I'm like, well, his smile, his thing, they fix his teeth too, okay, and so that's really cool and something to think about. But here's what I'll ask you about, and it's kind of I don't want to say it's a controversial subject because it's something that took place up in Flint, Michigan. And we know up in Flint, they had a water problem where they had lead in the water. Now, we know about the effects that we have seen plenty of specials on the effects that has on the brain and so forth, and things like that. But they never really talk about the effects on the kids' teeth because, we were talking about fluoride a few minutes ago. And if children are not getting enough fluoride that they need and how that affects their teeth, talk about just the importance of not only children, but even when babies are born. I got a friend, matter of fact, the musical producer of the show, he has an infant. He just had a baby. What are the early oral hygiene things that you should be doing with a child if you have a child that is growing? New infant, toddler, the stages of it.
Well, in the sense of 1 and 2, 0, 1 and 2, they don't have teeth. And when they develop their baby teeth, which all their baby teeth were developed in utero, which is before they were born, of course. And you're talking it's whether you live in an area that has fluoridated water or how hard your enamel is. So there is a direct correlation with the amount of decay for a person that lives on well water without fluoride and a person that lives on city water that has fluoride. The problem is that then if you live on well water your whole life, your enamel is soft enough, because when I drill on teeth, I could tell whether the person has fluoride in the water or they didn't, because their enamel is so soft that it's like butter. So we drill a cavity and we know it's this person has a high decay rate. So there is a direct correlation between fluoride in the water or having well water when you're during development on whether or not you have soft teeth and your decay rate. So it used to be years ago that we would actually test the water of our patients for the children to make sure they had fluoride rinses if they didn't have fluoride in the water. This is a controversy now because people think that fluoride might be bad for certain parts of the brain, affect the way it chelates with some parts of the pituitary gland. So it's a very advanced thing, and it's very complicated that you would have to do research on. But back in the 80s when I started, we would actually evaluate the fluoride in the water of well water people and try to help them supplement with fluoride to harden the teeth of their children. We don't do that anymore for the reasons of the controversy, but the main thing is when they're growing up, just make sure that you clean their teeth with a washcloth. You basically rub their gums as they're coming up. Make sure they're doing that kind of stuff.
Okay.
Yeah,
Now,
there's just regular. You brush and let them suck on a brush. Yeah.
now listen.
Put some toothpaste on a brush and let them suck on it. Yeah.
Hey, look. I'll tell you. I'll be the first to tell you. I'm a well water baby. My I remember. Oh gosh. So it was a very unique situation for me. Being is that my mom, she was a teacher at Ragsdale High School. And
Wow. My
yeah,
mom was a teacher right away.
oh, my mom was a teacher at Ragsdale High School for many years. She taught biology. And then you're looking at the mascot. I was the mascot for Ragsdale High School, 79, 80. I can't remember. I even got a little diploma. It was kind of cool. But directly across,
Wow.
yeah, directly across the street from Ragsdale High School, guys, is Guilford Technical Community College. Now the cool thing was,
No, yeah.
yeah, the cool thing was is that even though I had well water, you know, they had I believe they have a hygienist program over there. They used to.
Yeah,
Anyway.
my wife went there then.
Yeah, they used to.
My wife was there then.
Oh wow! And so they used to have this hygienist program at GTCC, and you could go over there and get your teeth cleaned by these students who were being, you know, they were being watched, of course, but you could get your teeth cleaned for like next to nothing. And I can't remember how many times, like my mom was just like, okay, it's summertime, and you know she had these summer workshop programs. You know what? I'm gonna take you across the street to get your teeth cleaned. You know, it was just like one of these things that she would do, and so I was constantly getting my teeth cleaned. And I know for a fact that my niece, who's here when she was growing up, I know that my sister, because we do have well water, did have her rinsing with a fluoride supplement. She had her rinsing with a fluoride supplement every time she brushed her teeth. So yes, I didn't know that the damage.
Yeah, we still when the 6-year-old, when the 6-year-old and the 7-year-old and 8-year-old and 10, we give them a fluoride treatment still. It does help harden the outer surface, but the matrix or the internal structure of their teeth have already developed from. So there's no change. You can't change the matrix. So the matrix of the enamel of a tooth is developed internally from what's in the water and what's in the diet. So you can supplement the outer surface to protect teeth. That's all you can do.
Now,
After they're developed, but while they're developing, when they're young at 4 or 5 and 6, you could give them an oral fluoride, but we don't do that anymore in general.
right.
That's changed.
Now, it's funny that we're talking, and I'll touch on something. I won't say that the psychological effects, but I remember it had to be about, I'll say third grade, where we're putting the bridge, whatever that tooth is that's there. I know that the main tooth is a molar, I believe, but that tooth was pulled at a very young age, and it was a permanent tooth. It wasn't like it was a baby tooth. That was a permanent tooth. Even if it was still in the growing process, that was a permanent tooth that was pulled. And over the years, it had never been taken care of properly. I had some bridges put in, this, that, and the other. They would fail after a while of time, this, that, and the other. And here I am. I end up with you, and it fails again. And you're like, well, you really don't need a bridge here. We need to look at another way to do this to make this right. Um, and from a psychological standpoint of knowing that we're going to fix this to the point to where it's being fixed properly, because I will tell you, being in the military, you find yourself in unique situations where they were doing the right thing. I was a teaching moment on more than one occasion where I had a room full of dentists standing, guy residents standing around me as this colonel was like, see, I'm doing this. I had some very unique roots that crossed over each other that you don't see all the time. So anytime you run across that, he's like, hey, do you mind if I bring a couple of students in? You look up, you got like 10 people standing around you. And you're like, all right, whatever. But from a psychological standpoint, I'm so excited about October 12th because it'll be done. And I don't have to worry about, oh man, is this going to happen again? This, that, and the other, because it's being done in a manner that it should have been done years ago. But I digress because we just weren't at where we are in dentistry when I was having these problems then. So the options that we have now were just more advanced. And you can say, okay, look, we can go this route and you'll be straight. And that's pretty cool.
Yeah, well, it used to be conventionally, we used to do dentistry where we used to do bridges and root canals. But the longevity of that is based on, again, it goes way back to what we talked about at the beginning of the session. If your bite's not right, if the dentist puts it on where the bite is wrong, if you don't have a certain kind of bite, it'll fail. So, and bridges and root canals can split and fail, where implant dentistry for sure is more permanent in general, 99%, 98, 96% success rate. 11 years, 10 to 15 year average for a long bridge or a big bridge with root canals attached to it. So we've changed our philosophy a little bit to try to not go the old route from back in the 80s and the 90s, and we do more implant dentistry than doing root canals on little teeth that are going to break and fail in 11 years or 8 years or 7 years. It's a waste of money sometimes. We selectively choose the case based on the situation, of course. But yes, there's been some changes in dentistry towards implant dentistry for sure.
Oh wow, that is. I mean, I'm excited. I'm happy about it. So now I'm gonna make my audience laugh a little bit. $1 million question.
Okay.
So, do they teach you in dental school to keep that horse needle? Like, I think it's an art to being able to hide that Novocaine needle, because I'm telling you, it looks like an alien probe. And every time I get stuck with it, if you see one of these things, I'm telling you guys, if you all see the needle that they use, I don't think that needle has changed. When they put Novocaine in, it hasn't changed for a gazillion years, and that thing looks. You're like, you're gonna stick me with this? There's no way I'm gonna let you stick you with this thing. And every dentist does the same thing. They have it behind their back. They come at some weird angle so that they couldn't see. I'm telling you, I think it is hilarious every time it's done. I think it just is. I'm excited. Go ahead.
The good news is the pain. Most of the pain comes from the acidity of the anesthesia, the burning of the tissue from injecting the anesthesia, not the needle stick. The pain comes from the acidity. So what we've changed in the last 4 years or 5 years is that we buffer our anesthesia. So the anesthesia now that we use on you when I numb you, okay, whatever, is buffered to the pH of the body. So this is new. So we use buffered anesthesia because most of the pain of an injection is from the acidity of the anesthesia, because it's like putting acid in your gum. So we buffer that, and it's basically the pH is the same pH of the body, like 7, 7.4. I know it's a little complicated, but so when we inject the anesthesia, it doesn't burn anymore. So the pain is way better and less. The needle looks long still, but the pain from an injection is not from the needle stick most of the time. It's from the pain of the anesthesia going into the tissue and burning it because of the acidity of the anesthesia.
Wow, wow. I mean, at least like you said, now you have the little numbing stuff that you can put on. A lady said, he said that needle and the sound of the drill is pure torture.
Yeah.
Oh man. I would tell you that is funny that you say that, because I've watched a number of shows, and going to dental school, I know that you're going to know the history of dentistry a lot better than me. But one of my favorite, I like to watch westerns, good ones anyway. And one of my favorite ones was Deadwood. And when I saw them, and I think about some of the stuff that I saw in Deadwood when it came to medicine, the dentist, it was two things that I saw. It was when one of the characters got like a toothache, and they called themselves being dentists, and I was going, over the years, how did they come to find exactly how did they come to find exactly where you stick for what nerve? That's what I really want to know. So like, you're going to work on tooth number 28. How do you know where to go in to numb that area? Because it's not like you numb the whole body. I mean, you walk out your face feeling all kind of, but how do you know exactly which area to go to?
Well, the lower jaw is different than the upper. The bone's different. So basically, on the upper, any tooth you work on, you just infiltrate next to the tooth, and the anesthesia fuses through the pores of the bone.
Okay.
On the lower, the bone is compact and solid. So there's no pores in it. It's like your leg or your arm. The bone is solid, so you have to block the nerve coming out of the brain. So on the lower, you have to block the jaw, and on the upper, you have to fuse anesthesia through the pores of the bone, which is different. So it's easier on the upper to numb sometimes because you're just putting it next to the tooth. On the lower, you block the whole side, so it's totally different situation.
Yeah, but you make it sound so simple. Somebody had to be the first. Is my thing. Is like somebody, hey, we got this new drug. It's called Novocaine. We're going to see if we can make this work. All right. Do you feel that? Yeah. And I mean,
yes. I don't know about the history of that whole thing. That would be tough to like. I don't know who was the first one, but it for sure is different on the upper and lower jaws. They're totally different situations.
Right. That is just crazy to even think about how the advance in dentistry, because somebody had to be the first. I know, like, my pain tolerance, I don't want to say it is low, but I'm going to let you know. And I'll tell y'all, Dr. Mackey comes in and he's doing like a million things, and he's like, yep, you're stuck. Before you know it, you're like, I'm numb. He comes back. He gets right to work, guys. It is so funny. He's like, no nonsense. He'll come in, he'll speak. How you doing? All right, do you feel this? All right, I'll be back. I'm going to give you some more. And he's back out. And before you know it, you're numbed up and he's going to work, which is really cool. Oh, man, that is awesome. So,
Thanks for the comment.
Oh, you're welcome. So here's the at the end of the day, basic things that we should be doing. What? Brush after every meal. Right? Brush after every meal. Try to floss. If you can't floss, like you said, we made some recommendations of the Waterpik Sonic Fusion toothbrush. You said Philips has got another one out there. or just use a water pick. I have a water pick that I've been using. My Aunt Elsie has used a water pick for years. And I said, you know what? I'm going to buy a water pick. And as soon as I bought my water pick and started using it on a regular basis, you could tell the difference that I was using it. So brush after every meal, floss. You definitely want to, as far as toothpaste, there are a lot of good toothpaste out there, inorganic, and I'm sure, guys, everything that what I'm talking about, talk to your dentist. Talk to your dentist that you have. If not, just do a little research. I know these days you can find about just about anything online.
For sure.
About anything online. But hey, brush after every meal. You want to floss. You want to make sure that you are having healthy oral hygiene as a whole, because that is something that, like we said earlier, it does
affect your body.
It affects your body. It definitely affects your body in more ways than one. Dr. Mac, it has been awesome having you on today. I really appreciate you taking the time out of your busy schedule to come on and roll with Ramsey. I know that people are definitely going to come back, listen to this, and just think about a lot of the things that we've said and the things that we've discussed. And I'm sure we've shed a light on a lot of things that people just haven't thought about when it came to their oral hygiene. One of the things that I want to key on that you said is, particularly with your practice, as that you look at the total care. You're just not just hey, I'm going to come in, you got a cavity, we're going to clean you, give you a filling, this, that, and the other. You look at the total care and the effects on the body. And on top of that, he can give you $1 million smile. So, hey, you know what? You got it all right there in one place, man. Hey, Dr. Mac, I really appreciate it. I'll see you on October 12th. And when I see you, I got a little surprise for you. I'm going to bring you an official Rolling with Ramsey hat. You've earned one of those. And that's going to be cool. Hey, and I want to just say it again. Dr. Mac, you have been officially doing what?
Rolling with Ramsey.
Rolling with Ramsey. Hey, thanks, Doc.
All right, buddy.
I'll talk to you soon. All right,
see you then, buddy.
I'll see you then.
Have fun.
You too. Wow. So that was really cool. Having Dr. Mac, Dr. Keith Macdonald on board, and having him go over some things as far as our oral hygiene is pretty cool. Our featured song of the day has been Silver Wings by the artist QB Smith. You guys heard that when I was introducing Dr. Mac, and I'm sure that Q will throw it in throughout the show, and so you all will be able to hear that. Man, I just want to thank everybody for tuning in. Aleda, I appreciate you having some questions there, and being able to just learn and gain more information, which has been phenomenal, because you learn something new every day. You always do. So remember, hey, oral hygiene is important. Hey, oral hygiene is important. We want you to remember that. You got to take care of your teeth. That being said, like I said, this is the first of 4 shows in a healthcare series. Next week, we are going to be talking to Dr. T.K. Feaster, who is an emergency room physician. She's an MD in Montgomery, Alabama. And it's going to be really cool to have her on board. She's on the front line fighting COVID. But just to hear some of her stories about what she's seen in the emergency room, woo, I'm excited to have her next week. It's been a blast. Thank you guys. Remember, please, hey, go to the YouTube page and subscribe to the YouTube channel. Follow us on Instagram. Like us on Facebook. Share with all your friends. And you can listen to the podcast on Apple Podcasts, iHeartRadio, Spotify, Google Podcasts, Amazon Music, and now, as of Wednesday of last week, Save Radio as well. Shout out to MC Maserati. I really appreciate you. Hey, guys, another week is going by. We are too blessed to be stressed. And thank you for Rolling with Ramsey. See you guys next week.
to the floor.